health today unknown. Welcome to another edition of Eyes on the Road on this amazing Thursday afternoon. Well, it's not just any other Thursday. Amazingly, it's the last Thursday of the month. Yes, we thank God for keeping us to the last Thursday of the month. Yes, of course, the end of the month, which of course will be next week, July. Yes, but this is the last Thursday of the month. So next week, Wednesday, is the last day of the month, but this is the last Thursday of the month. Yes, if I got that correctly. So today is our open day on the show. Okay, so for those who are regulars on the show, you know, the last Thursday of the month is our open day. So stay tuned as we take you home in grand style as you listen to your favorite weekly health tonic on the airwaves. Yes, you know it. It's Lagos Traffic Radio 96.1 FM as our in-house optometrists are here to give you free consultations from now until about 5 p.m., giving you valuable health tips as we answer your eye questions. Yes, we are here for you. Welcome to Eyes on the Road. I am Akan Usen. All right, so as the show progresses, we'll definitely be giving you traffic feeds to keep you abreast of how things are looking like on the roads. But from my view at this time, I have a good view of the Bagada Expressway where things are still looking quite friendly. The Ojota end, well, of course, we're aware of that. The road rehabilitation of that expansion joint on the Odoyala Bridge, which of course has necessitated some sort of contraflow on that stretch. Hence, it is a bit busy on that end, and it definitely will get busier as the day progresses. So please, if you're not already in that stretch, you could, just take advantage of other alternative routes, but at this time it's still looking not so heavy, not so busy. And yes, our discussion in the month of July was centered on myopia. It was Myopia Awareness Month. We discussed the impact of myopia, we spoke on how it affects children, how it affects drivers, and other occupations. So today we're opening up the phone lines, and we urge you to feel free to share your thoughts via calls, via WhatsApp. Ask any question about, it doesn't have to be about myopia, any eye health challenge, okay, from the beginning of the program, okay, and I definitely am sure it will be an exciting and informative time. Enough talking on my part. Let me welcome our doctors on the show this afternoon. Dr. Priscilia Imade, a doctor of optometry with a PhD in public health and consultant optometrist at the Modern Eye Care Foundation. And she's not alone. We have Dr. Rasheedat Aruna, Chief Optometrist at the Modern Eye Care Foundation on Moli Ojudibaja, Lagos. Welcome, doctors. Welcome, doctors.
Thank you.
Thank you very much, Akan.
All right, so great to have both of you, a tag team, on the show. All right, so how was it getting out to the studio today?
The road were very, very free.
Very free.
Yeah,
interesting.
very free.
Interesting.
And the weather is good too.
Okay. So my doctors, over to you.
Yeah.
Even as we expect phone calls,
Exactly.
Yeah, but let's start off.
It's open day. Good afternoon to all our listeners once again. I'm always excited to be here, and it's a big honor and privilege for me to share eye health tips, eye health topics, eye health care with you. Today is open day, and we are going to be taking the questions straight away. I'm going to ask Dr. Aruna.
All right,
So
good evening.
let's go on to the questions here.
Okay.
Good evening, everyone. So, straight away, I'll be asking a question here that says, "Good evening, doctor. My child of 5 years old wears glasses, but he still squeezes his eyes to see things. Is it normal?"
Still squints.
I think that's squinting.
Yes,
That's trying to close the eye
I think so.
to see. And some children actually do that.
Yes.
When they want to look at something, they try to close their eyes, to shut their eyes to focus.
Yes.
So what does that mean?
So it's possible. It's possible that I think I should ask, how long have you been using the glasses? Okay, because glasses expires, and once it expires,
Really?
yes, it becomes.
What do you mean by glasses?
No, that's what you said. I said really, because I don't want to know. I know
Yes,
someone that.
that's why we're on this show, to educate you.
Wow.
Yes.
You know someone that been wearing glasses.
Yes,
the same
that
glasses
particular one.
for 10 years.
Yes, as it was
You
in the
remember,
beginning.
Dr. Aruna, there was a patient that came
Now
to the
is
clinic.
and forever.
He's been using one glasses for the past 7 years. He said,
Wow.
I don't know that I have to change my glasses.
Ah.
Okay, go ahead, please.
So once the glasses expires, of course, it will be difficult for you to see through such glasses, and then you have to squint because you want to accommodate. You're not seeing clearly, so you have to squint your eyes to see clearly. So it's possible the child glasses has expired, and it's possible also that the prescription is no longer effective for his vision, so it has to change.
Oh, so could it be that the
Yes.
eye challenge has sort of maybe changed,
Worsen,
worsened, or
yes,
is
possible.
better?
Well. It's more of maybe worsen
Worsen,
than
okay.
better,
Worsen,
because
okay.
if it's like that, the doctor would have also told them that we're using these glasses for a therapy to be
correction.
changed for,
Okay, after a
you know,
while.
after a while. Yes.
Okay,
So,
okay.
so it's normal for you to do yearly eye tests.
Yearly eye test.
Yes,
Okay.
and then change your glasses at least every 2 years.
Okay, so for children, it's recommended
both
yearly.
adults, everyone,
Everyone.
everyone should check their eyes yearly.
Okay. Okay.
Then change your glasses at least every 2 years, or ask your doctor.
Recommend. Sometimes for
Exactly.
children, it can maybe see 2 years, but at least have your eyes checked every year. And then if there's a need to change it for children, your optometrist will advise you. But for adults who use reading glasses, most likely after 2 years, it will definitely change.
Okay.
Yes.
On a lighter note, I remember the other time you were saying sometimes you see someone who is always, you see the face like he's frowning.
Yeah.
Person is squinting, and you
That's
feel the person
squinting.
is
Yes.
proud or pompous.
Yes.
Whereas the person is
Doesn't
just
want-
trying,
Person not
to
seeing
see.
your
Just trying to
friends.
see, just squinting to see. Exactly.
All right, dear listeners, like I said earlier, the phone line is open for you. Do call in with your eye challenges. Our doctors are here ready to tackle them and, give their comments and, prefer solutions. 080-991-20777. They came here because of you, okay? 091-538-77127 or 080-991-20777. That first one is also our WhatsApp line. So you can also send in that message via WhatsApp. Would love to hear from you. Yes, back to you, doctors.
Okay, I think along with the question Dr. Aruna just answered, there's a similar one here that was sent to me here that says, Doctor, my child have been using glasses for over 10 years and the power keeps increasing. The glasses is thick and I'm worried for my son. What really is the cause? Bola from Magodo. Dr. Aruna, that question I think is a follow-up. Looks like a follow-up to your question.
It's related.
Yes, they are related. For a child wearing glasses for over 10 years, when we are correcting eye problems in children, because that child is still growing, there's a tendency for that refractive error to grow with the child. If after 10 years he's still wearing glasses, and then it means the child has a progressive myopia or progressive hyperopia, so as eye problems that can keep increasing as the child is growing. And so the lens prescriptions too can also keep increasing. If it says they are thick, most likely it may be a myopic case where they start teasing the child that your glasses looks like bottle.
Yeah.
And sometimes some children too can start feeling a bit ashamed of their glasses, having complex and then low self-esteem because of the glasses. The good news is that technology have kind of made that easy now. There are some newer lenses now. There are ways that those lenses can be compressed such that no matter the prescription,
Doesn't have to look so
it doesn't.
thick.
Yes, it doesn't have to look like Coke bottle like they always say. And there are contact lenses too. The parents can think of the option of contact lenses if the child can actually cope with that, if we can maintain it. Contact lenses, when you wear it, nobody will know you are wearing glasses. And for the prescription, just increasing and increasing, well, it depends. We always encourage parents to bring in their children on time. We don't know at what age this boy started wearing glasses. There are some eye problems that can be corrected before the age of 8.
Okay.
But we discovered that many parents in Nigeria, they don't bring their children to the clinic at around that age. They start bringing them after 8. Once they are over 8 years, most times they have to keep wearing the glasses because it has to be just as a corrective measure at that time. So I would just encourage this parent not to be discouraged. They just come. We can always look for ways or alternatives around this. I don't know if Dr. Aruna, you want to say something?
Okay, no, I'm just in a similar question that one doctor, I have myopia for over 20 years now.
Oh, okay.
And I've been using glasses since then. Is there no permanent solution? Because sometimes I'm tired of using the glasses.
It's true. I hear this regularly. And really, you know,
day.
for somebody to be wearing glasses every day, I can. You think it's easy?
It's not.
Glasses are foreign bodies. There are things you put on your face externally. But you know, you can make it fun. You can make it interesting by wearing, wear fanciful glasses. You can see the one I'm wearing now. It's very beautiful.
I have a patient that have 20 pairs, over 20 pairs of glasses.
Has plenty money.
No, it becomes part of your dressing. Make it part of your dressing.
Colors.
Different colors. Just use it as part of your dressing and just, you know, fashionista
Let it flow.
and make it.
That one is no longer recommended. It's recommended. 20 pairs.
So the permanent solution to refractive error or myopia most likely will be surgery, LASIK surgery, LASIK eye surgery.
And that is possible in Nigeria?
Yes, it's possible. So you just need to discuss with your optometrist so that you can explore that option, right?
Okay. I think there's one interesting question I just got here. It says, can using computer a lot, watching lots of television and reading a lot cause is it damage or eye damage? I don't know. Yes.
You understand what the person is trying to say now?
Yes. So
go ahead. Yes.
You've actually spoken about this. You've talked about this.
Yes, computer effect of computer on the eyes.
The syndrome and all. I remember.
If it can cause serious damage, then maybe everybody in the world will just be maybe blind or something.
Well, there's a whole new myriad of problems that will come up that statistics are showing now. That in the next generation, eye problems centered around this area is going to be on the increase because of the exposures.
Yes. So it can cause eye strain, digital eye strain.
Digital eye strain.
Yes, because you find out that most of the time when you're focused on your screen, your phone, your laptop, you're just focused, you're not blinking. Your blink rate reduces, and then it can lead to dry eyes. Dry eyes is another serious eye issues that even children have it because they spend most of their time on their phone. You know,
and when the program is so interesting,
maybe they're
and those days the children didn't used to have dry eye except it's an exocrinopathy. But now you find children having dry eye.
Yes, and then your eye muscles are not relaxed, and then these blue rays of light, it affects your sleep pattern. Then it also I think research has shown that it can affect your macula, and your macula is a very important structure in your eyes that you don't want to be affected because it can cause vision loss. So you need to, number one, while working on your screen, you have to do you have to take breaks at interval and consciously make effort to blink, and then use computer glasses, especially if you're going to spend a long time on screen. So it's not going to cause like blindness. Maybe just like Dr. Imade has said, in the future, those things can occur if it's not watched, but it can affect your eyes.
I think that's why we advise workers or anybody using visual display unit to have computer protection glasses. Or have filters on your screen.
So the computer protection glasses is not like
anti-reflex.
It's not like a recommended. It's not a lens.
It's coated in addition to your prescription if you have a refractive error, or it can just be a lens that is made for you with those coatings on the lens, even when you don't have an error. when you don't have, there's no need to wear glasses to really see.
Let's quickly take a look at the traffic situation at this time. Movement from Bolade Oshodi Junction inwards airport bus stop through Shogunle PWD airport turning looking good. Airport bus serving was national still good. Of course, we know as the day progresses, it might get a bit busier. National link was Ajay Farm through Ikeja Bridge. I understand that it's beginning to slow down. Ile Zik, Cement, Sule Junction. At the time of this report, it was still looking friendly. On the reverse stretch, Yanodokpemu inwards Cement, good. Stretch of Cement inwards National, good. A bit of a delay at National. Outwards journey to Bolade from National, free. A bit of a delay at the airport turning and Shogunle due to traffic lights alternation. And the CMS bridge, I understand it's slow. That's inwards of Fin Canal due to high influx. Of Fin Canal Market inwards Jora Lokpa by Nepa intersection, good. Descending CMS bridge inwards UBA roundabout to connect Ina Marina, good. Slow from UBA roundabout inwards Akpongbo under the bridge. Slow on Broad Street inwards Akpongbo under the bridge, connecting of Fin Canal Market and Ologbowo. Movement on Eko Bridge inwards Akpongbo connecting CMS proper, good at the moment. Eko Bridge inwards Elegbata, Ebutero Market through Ejalo Nibu Market down to Police Post, also good. Ebutero Market inwards Leventis through UBA roundabout connecting Inner and Outer Marina is very good. We'll still await your calls 080-991-20777 and 091-538-77127. Back to you, doctors.
Okay, it's an interesting question here. It says, good evening, doctor. Well done for your good works. I recently lost my husband 3 months ago, and I cried a lot then. But I noticed that my eyes are now blurry. Could too much of crying affect my eyes?
Right.
This is Miss Deborah. Mrs. Deborah.
I know you said tears are good for the eyes. Did you say something?
Yes, I think sometime last week.
Too much crying?
Sometime last week, a patient came in and she was like, she lost her husband. Yes, and that she has been crying, and she will want to check her. Though she uses eye drop, she feels her eyes are not okay because of so much cry. So it's just similar to this.
Some of the sight away.
So crying can affect your eyes, of course.
Really?
Yes, it can affect your
Crying
eyes.
is emotional.
I'm learning a lot to do.
Yes, it can affect the eye.
How?
So when you cry a lot, minus the fact that you are bringing out tears, maybe it's helping you cleanse your eye, but it exerts pressure on the eye in one way, and then the eye aches. You understand? Your eye
becomes heavy.
That's why it's red.
Yes, your eye becomes heavy and like red, of course. So it gives so much discomfort. Stress, exactly. So it usually affects the eye.
It's an emotional thing. Crying is an emotional thing. And in the eye, we have majorly two types of tears. You have your basal tears and your reflex tears. The basal tears are mainly the tears that are always in the eyes, and then the reflex tears, they are the ones that maybe when something happens, it keeps coming out, and then when different emotions can actually swing you to popping out these tears. Tears in itself may not necessarily prevent you from seeing or damage your eyes, but because of the emotions attached to this crying and and things like that, it can like secondarily medically we may not be able to just pinpoint that this is how it damages the eye or whatever, but over time we've noticed that because of the emotions attached, some patients have actually reported having a lot of blurriness because of having cried for
too much.
Yes, over a long period of time. But by the time they relax again and get themselves, you just discover that
they get better.
The vision is.
And I think it gets worse for people that have already existing eye
problem.
Yes, so just go to the eye hospital and you'll be examined. Okay. Then a question here. I think it still boils down to myopia.
Okay.
Greetings, doctor. Is it true that staying indoor for a long time can cause myopia? Yes.
Doctor.
So for especially for children, actually.
Yeah. Okay.
So in recent times, children, they spend most time, like I said earlier, on their digital devices.
Okay.
So studies have shown, I think in some Asian countries, that long time spent on such device induces, because we are doing so much near work,
Yeah.
it can induce myopia. All right, so yes, it can induce.
So how much time is okay for a child with a digital device or watching TV? How much TV is too much?
I think
Okay.
there are, we have organizations that are in charge of that.
Okay.
There's a minimum threshold that is required for room lighting for you to watch, and also there's also be some estimations according to age
Okay.
of what these children should spend in front of the digital display unit. But generally, there's this 20-20-20 computer rule.
Okay.
That if you focus for 20 minutes,
All right.
look away at 20 feet,
Okay.
and then after 20 seconds you can look on again. Well, children may not be able to do that,
Yeah.
but as much as possible, depending on the age, depending on the task, we encourage teachers or parents to ensure that their children take breaks, whenever they are working on the system. And also the proximity, how close you take it to your face.
Okay.
It's also an important factor to consider. Those days when we were growing up and there was television was always at a distance.
And
It wasn't too close and it wasn't too big. Exactly. So, but now a lot of changes to that. I think moderation is important as far as these are concerned.
All right. Any more questions? Even as we, wind
Are we
things down.
winding up?
We still have some time.
We don't have time. Yes, some of these questions I've answered them in my book.
Yes.
You want to know more about how to take care of your eyes? You can just read them up in the book. And of course, we're always saying our emphasis here is that no one should go blind. How will you feel if after you have worked your youthful life, you have retired from service, when it's time for you to enjoy yourself, enjoy your children, enjoy your money, blindness comes knocking? It's a very painful experience. I've seen many patients, male, female, old, young, lose their sight or going blind, and they are like, I will do everything to get my sight back, and yet there's nothing that can be done. That's why we are here. Prevention is the main thing. Prevention is better than cure, as we say in our local parlance.
Yes.
So let's prevent these eye problems so that we can enjoy our eyes even into old age.
There's a question. Good day, doctor. I noticed that my child's eye turn out, but sometimes they are straight. Will it stop as she's growing up? So this is a typical example of squint or strabismus.
Okay.
So the eye, some people, you notice that they are looking at you. One eye is, turning
But it's
outside. I think
looking
it's
somewhere
looking somewhere else. So that's the situation here. And for children, if it is corrected early, it can be managed and it can be corrected. That's just
How about in adults?
So in adults, the chances of correction is
Without surgery.
without surgery. Yes, if you don't do surgery, it's just going to be permanent like that.
Okay.
But if it's something that can be corrected surgically, then it can be corrected. But if not, if you're already an adult, there's no non-surgical solution to it. So that child should be taken to the hospital, to the eye.
I think there are glasses too, prism,
Yes.
or basal glasses
And some
that can help.
Yes.
So just straighten the eye while the child is wearing the glasses.
Yes.
Okay.
So some of those squints are refractive, meaning that once you are putting on your glasses,
Yes.
the eyes
We
will
straighten.
straighten out.
When you take it out,
And to go back
when
to
you remove your glasses.
When you-
Yes, I think I got a similar question like that during our program on Sunday, during our seminar. Someone asked, why is it that when I wear my glasses, I see very well? When I remove my glasses, I can no longer see again.
what kind of question is that?
But it's the truth. Most time when you wear your glasses are corrective. Once you wear it corrects the eye, it puts the eye in the state that it's supposed to be for you to be able to see. When you take it out, your eye will go back to where it was before. So
There's a similar question here.
Mm.
He said, I have a sister that her glasses is thicker than bottle and she can't do without her glasses. Is there nothing else that can be done? Maybe operation so that she can stop using glasses?
or
Yes.
contact lenses.
Yes. Yes, she can explore contact lenses.
Yes, contact
Contacts.
lenses is one thing I discovered. People are afraid to use. Yes, say no, doctor, I don't want to put anything inside
but
my
we see
eye.
a lot of.
But
especially
those
the
that do
female-
fashion, they wear
yeah,
it.
they
When
do
you
it
now
more.
tell them to use it for correction, they start getting scared. So contact lens is a good way to correct your eye problem. It's one of, if you travel outside the country, contact lenses is, a lot of people use it just the same way we use glasses here. Yes, and it's good.
Also, for very high myopia,
Yes.
we have auto K correction.
Okay, what was that?
Autokeratology.
Okay.
So there are lenses, special contact lenses that you wear overnight,
Okay.
and then it flattens the cornea, kind of corrects the shape of the cornea, so
No
that
side effects.
no side effects. When you wake up in the morning, you just take it off, and then your vision as clear as normal.
It's a form of treatment for myopia.
All right. Even as we round up, let's see if we can just squeeze in this call. Hello.
Hello, good evening.
Yes. Good evening. Welcome. Your name and location, please.
My name is Egosa and I'm calling from Ogba.
All right. Please go on.
Okay, so I want to ask the doctors,
Yes.
like, how old should a child, like, okay, so my child has been using glasses for a very long time and it's myopia. So at what point is the myopia supposed to stop progressing or growing? Because every time we go, the glasses power is always increasing. I always have to change glasses. Every 1 year I'm changing lenses. So what can I do? Or when is it going to stop growing? What can she do so that the myopia will not grow?
All right. Thank you very much for that question. Even as a round up, doctor, let's just round up with that. Time. Those are from.
We've already answered that question
Yes.
because of our talk.
Yes.
Maybe after this.
All right, so I'll call the doctor's number, Dosa. I hope I got that correctly. Just call after the show, and the doctor would, of course, recommend something for you or talk to you. Since she said every year it has been the reason. Well, it's all good.
That's a progressive myopia.
Indeed.
Or degenerative myopia.
All right, so I'll be giving you the doctor's number. Of course, on this show, like Dr. Priscilia said, that no one should go blind is our reason for diligently bringing you this show every week. We value your feedback on discussions treated on the show in order to better serve you better. Please continue to share your thoughts. Do not forget, Dr. Priscilia's book, I Care the Right Way, is up for grabs, yes, on sale. Do well to get yourself a copy. Feel free to visit past episodes at your convenience on our Facebook page, Lagos Traffic Radio 96.1 FM, and our YouTube channel, Traffic Radio 961. Search for the keywords Eyes on the Road, and remember to share. Thank you, Dr. Priscilia Imade, for always, making out time out of your busy schedule. And thank you, Dr. Rasheedat Aruna. And yes, we really appreciate you. Time is not our friend. You can reach Dr. Priscilia Imade on 08033336672. That is 08033336672. And the hospital address is plot 16 to 18 Ogunusi Road, opposite Omole Estate Phase 1 by Akiode Bus Stop Ojodu, Baja. On behalf of the production team led by Micah Arocha and our executive producer Tayo Akonle, my name is Akan Usain. Have a safe drive to your destination. See you next month.